Guys, a very good evening. As we have announced, we'll be starting our video-based question series from here onwards, right? Now, today I'll be discussing few of the questions and we'll try to emulate how it has been asked in the exam. I want you to participate actively in the discussion so that we can make this a little bit more fruitful, all right? Hi, good evening, good evening. I hope everybody is able to see, hear me clear and perfect, right? All right. So if you are good, let's start with the first question and then we'll try to build up a little on from there on, right? Now, the first question is, I have a 12-year-old boy. I have a 12-year-old boy. Right. I have a 12-year-old boy who is presented with sudden severe onset of abdominal pain, right? Now, this abdominal pain, which was diagnosed as an intestinal obstruction, based on the video provided, identify the condition, right? So, I have a patient who is a 12 years old kid with dynamic bowel obstruction. I'm going to show you a video. Your job is to identify the condition. Now, whenever you get such questions, before you play the video, look at the options first. Are you talking about volvulus, intersusception, bands, or internal hernias? Even before you attempt this question, a 12 years old guy, what do you think is going to happen among this? For an internal hernia to occur, there has to be a previous history of surgery, which is not here. For bands or adhesions to form, again, it is usually seen after surgery, that is post-operative complications. There is no mention of surgery, so I can rule out option C and option D, right? I can literally rule out option C and option D, right? So option C and option D, I'm going to rule out. Now I have to see whether it is volvulus or intersusception. I'm going to show, see, yes, as most of you are able to guess the answer, looking at the question itself, you can say it is intersusception because it is child, dynamic bowel obstruction, lead point, Meckel's diverticulum, all these goes into favor. But if they show you the video will be in this particular context, right? So this is how the video is going to play out. Now you can see that there are loop of bowels which are present here. We're trying to negotiate, and then I want you to observe. Now you can see one loop of the bowel is telescoping into another, right? So we're trying to grab that part of the bowel loop and gently we are going to pull it out, right? In a bit you'll be able to see. Now you can see one loop of the intestine is now telescoping into another, right? So gently we are going to pull it out. Now if a loop of intestine telescopes, if a proximal loop of the intestine telescopes into distal loop, what is this condition called as? This condition is what we call it as intersusception. Now this is how the video or the question is going to play out. As absolutely correct, the answer to this question is going to be your option B. Question suggested. Right. As the question suggested, that we had a 12-year-old boy. Now this 12-year-old boy had dynamic bowel obstruction. Had the dynamic bowel obstruction. Right. Now we've shown the video. The correct answer, I mean, of all, I think you have seen all the options. The first option was volvulus. The second option was intersusception. The third option is going to be bands, that are adhesions. And the fourth option was internal hernia. The fourth option is internal hernia. Now, based upon the video, it is your intersusception. Right? So the first video, as you can see, that the proximal end of the bowel loop is telescoping into a distal end, right? All right. Now let's take another question. Now, in this second question, I have a 25-year-old female. Our 25-year-old female, she has now presented with complaints of swelling in the intraoral region. swelling in the intraoral region, and swelling in neck. And the swelling in neck. All right. Now, this is gradually increasing in size. This is gradually increasing in size. Now, based upon the video, I want you to find out what is the probable diagnosis, right? Option A. Option A. Option A. Do you think it is thyroglossal duct cyst? Is it your thyroglossal duct cyst? Option B, is it ranula? Option C, whether it is a plunging ranula. Option D, is it a sublingual dermoid cyst? Is it a sublingual dermoid cyst? Right? So the question is clear. Our 25-year-old female with the complaints of swelling in the intraoral region as well as swelling in the neck, the swelling is gradually increasing in size, right? Now you have to identify, is it a thyroglossal duct cyst, ranula, plunging ranula, sublingual dermoid cyst? Let's look at the video presentation to identify it better. Now, this is the video representation that we have. Now you can see that there is a swelling in the intraoral region, right? This is the intraoral swelling that is present. Then you will notice the swelling is present in the lower part of the neck as well, right? You can see which is here, right on the double chin, in the undersurface, right? Now there is swelling intraorally also. There is swelling on the undersurface as well. Now when I examine this, I'm looking for fluctuation. This swelling is fluctuant also. Great. It's a fluctuant swelling inside the oral cavity as well as in the underlying neck surface, right? I will do another test. I want you to notice what test is this. This is what we call it as a trans-illumination test, right? Now, it is not very brilliantly trans-illuminant because the underlying swelling is not getting illuminated. So, it is not a positive trans-illumination. Now, what do you think the answer is? What do you think the answer is? Okay. Now, this is where classically you will make the mistake by calling it as a plunging ranula. Okay. Now, this is not a plunging ranula because, first of all, whenever we talk about ranula, initially when you look at the part of the video, what is the word ranula means? What is the word ranula basically means? Ranula means frog belly, which is blue in color. Is the swelling blue in color? No. If it is not blue in color, you can actually rule out to be ranulas. What is the difference between ranula and a plunging ranula? Ranula is an extravasation cyst, plunging ranula is a retention cyst. That's the only thing. Another thing, ranulas arise from the sublingual gland. Now, they will not be uniform on either side. They're not bilateral. The swelling is usually predominant on one side. It is a unilateral swelling. Now, it's a unilateral swelling. Ranulas I'm talking about. Ranulas are unilateral swelling. Here you can see that it is symmetrically present. A swelling which is symmetrical arising in the sublingual region cannot be a ranula. So, if it cannot be a ranula, so I can rule out the option. I can actually rule out the option. I can rule out both the plunging ranula as well as ranula. So, both of them cannot be the answer. It cannot be a thyroglossal duct cyst because thyroglossal duct cyst is in the midline of the neck, not in the intraoral space. So, I can rule out this. By simply ruling out the option, you now get the answer, which is going to be sublingual dermoid cyst. This is a tricky question. Now, that is why I wanted you to emphasize on the video base here. I will again tell you why this is not a plunging ranula, why this is not a ranula, why this is a sublingual dermoid cyst. Again, look at the video. You will see there's a
swelling looks normal.
This is when you evaluate, you will notice there is an intraoral swelling. Now, this intraoral swelling is symmetrical. Ranulas are not symmetrical, they are asymmetrical. Here, they are symmetrical. Then you see there is swelling which is present in the undersurface of the neck. Now, this swelling which is extending from intraoral to undersurface, the first thing that you get is plunging ranula. But remember, it cannot be a plunging ranula because of two reasons. One, it is not ranulas are not symmetrical. They are asymmetrical swellings. Second, you will also find it to be bluish in color, where ranula is blue, where this is not bluish in color. Third important, ranulas are trans-illuminant. When you examine it here, you're not able to see the entire swelling glow up. It is not in your lower surface of the swelling is not glowing up. It is not presenting as trans-illumination. It cannot be ranula. In that basis, this is going to be your sublingual dermoid cyst. Is everybody clear with that? Quick feedback. Okay. Now that is the difference between your ranulas, your plunging ranulas, and your dermoid cyst. It cannot be a thyroid duct cyst because it is present in the midline of the neck, and the swelling will move upwards with deglutination as well as tongue protrusion, and we have not done this here. Absolutely clear? Okay, great. Now let's move on to the next question. Now the next question. Now patient is undergoing a laparoscopic cholecystectomy. Patient is undergoing a laparoscopic cholecystectomy, and you encounter a structure. You have now encountered a structure during a laparoscopic cholecystectomy. The question is, identify the structure. Identify the structure. Option A, is it a normal anatomy? Option A, is it a normal anatomy? Option B, is it a Phrygian cap deformity? Is it a Phrygian cap deformity? Is it a Phrygian cap deformity? Option C, is it a caterpillar hump? Is it a caterpillar hump? Or option D, is it a double cystic duct? Is it a double cystic duct? Right? Now, I've given you the question. Right? Now, this is the question. Lap cholecystectomy is done. Identify the structure during the surgery, and the video is this. Right? Let's look at the video representation, and I want you to identify this. Is it a normal anatomy? Is it a Phrygian cap deformity? Is it going to be a Moynihan hump, that is a caterpillar hump, or is it a double cystic duct? All right. So video goes in this particular form. It's a very short video. You should be able to identify it pretty quickly. Right? Again, look at the video. This is the gallbladder. This is the liver surface, and I want you to concentrate at this particular area. I'll move aside so that you can watch it better. And here you go. Okay. Did you identify? Did you identify? Right? What is this? But it cannot be a Phrygian cap deformity. Phrygian cap deformity is on the fundus of the gallbladder, which inverts in its own. Phrygian cap deformity जो है, जब आप बोलते हो Phrygian cap deformity में normal gallbladder, when you look at this is how the normal gallbladder will actually look like, right? So when you look at the normal gallbladder, this is how the normal gallbladder with its Hartmann's pouch and the cystic duct. Phrygian cap deformity में you see the fundus of the gallbladder is now going to fold on itself, and this forms like this. This is what we call it as the Phrygian cap deformity. ये तो वीडियो में नहीं दिख रहा था, ऐसे थोड़ी ना है, नॉर्मल तो है नहीं क्योंकि there was some structure. See, when you look at the video, I want you to identify this structure was actually pulsating. This is a pulsating structure. You can see this is pulsating, it is pulsating, and the pulsation is only seen in blood vessel. So the only option with the blood vessel is going to be your caterpillar hump. The caterpillar hump is what we call it as the Moynihan's hump. This can be formed by the common hepatic artery or by the cystic artery, which is going to make a loop inside it, or the right hepatic artery, right? So caterpillar hump जो बनता है, this is usually formed by right hepatic artery or the common hepatic artery, which is running in the calyx area. It is not a double cystic duct. It is not a double cystic duct. This is not a normal anatomy. So answer is your caterpillar's hump. Is everybody clear with that? ठीक है? Sorted है? चलो. Moving on to the next question. Now, in the next question, I have a 45-year-old female with swelling in the midline of the neck. With swelling in midline of neck. This is painless and gradually increasing in size. And gradually increasing in size. Now the video demonstration is given. You have to identify the condition. Identify the condition. Option number A, is it a solitary thyroid nodule? Option number A, is it a solitary thyroid nodule? Option B, is it a thyroglossal duct cyst? Option C, is it a subhyoid bursitis? Is it a subhyoid bursitis? Option D. Option D, is it an enlarged? Is it an enlarged pretracheal lymph nodes? Is it an enlarged pretracheal lymph nodes? So these are the options that you have. I'm going to show you the video and you are now going to tell me the answer for the same. I have a 45-year-old female, swelling in the midline of the neck, gradually increasing in size, and it is painless. And now you have the patient presentation to be like this, right? So she is that female. Now, I want you to look at the video and give me the diagnosis. You can see swelling in the midline of the neck. She is now swallowing. The swelling move upwards with deglutination. Then we'll ask her to protrude the tongue. Now, every single time she sticks the tongue out, look at the swelling. Every single time she sticks it out, the swelling moves upwards. Yeah, there you go, right? So now you have a patient who is having swelling in the midline of the neck that moves upwards with deglutination and also with the tongue protrusion. Now, if you have a swelling that moves upwards with deglutination as well as with the tongue protrusion, what do you think is the right answer to our question is going to be? Is it a solitary thyroid nodule? Is it a thyroglossal duct cyst? Is it a subhyoid bursitis or enlarged pretracheal group of lymph nodes? And the answer is, I hope everybody knows that the answer to this question is going to be thyroglossal duct cyst. This is the only swelling. This is the only swelling that moves upwards. This is going to move upwards with tongue protrusion and deglutination. And deglutination. So answer is thyroglossal duct cyst. Absolutely correct, right? Now, let's go to another question, which is again quite interesting. Now, this question, I have a 40-year-old male patient with inguinal swelling. With inguinal swelling. This inguinal swelling is painless and gradually increasing in size. And gradually increasing in size. A clinical test is performed. Clinical test is performed. And the question says identify the diagnosis. So what is the diagnosis? We want the diagnosis. Option A, is it an indirect inguinal hernia? Option B, is it a direct inguinal hernia? Option C, is it a femoral hernia? Is it your femoral hernia or is it your obturator hernia? Is it your obturator hernia, right? So these are the 4 options that we have. I'm going to show you the video and I want you to identify the diagnosis, right? So this is the video. Right. So I want you to look at the video and then give me the answer. Now there is a swelling in the inguinal region and I'm doing a clinical test. So in the clinical test, I have put my fingers in 3 different locations, right? And now I'm asking the patient to cough. Now, when the patient coughs, one of my finger is getting the impulse. Now, based upon that, you have to give me the diagnosis. First of all, what is this test? What is this clinical test? What is this clinical test? This is your 3-finger test. Now, the 3-finger test, you look at these 3 fingers which are presented here. This is your index finger, this is your middle finger, this is your ring finger. So, index finger is going to be at the femoral ring. The middle finger is going to be at the superficial inguinal ring and this is going to be at your deep inguinal ring. And now you're presenting across it, right? Now, when the patient is coughing, you're getting the impulse. You're getting the impulse at the index finger, right? You're getting the impulse at the level of index finger. What do you think the answer is? I'm going to play the video again, right? So I've marked the superficial inguinal ring, which is here. The deep inguinal ring is here, and this is below that level. And the answer is going to be your femoral hernia, right? So answer to this question is your femoral hernia, right? Now, this is a very important clinical sign. You have to understand. See, in a ring occlusion test, I will use the thumb and I will occlude the deep inguinal ring. In a 3-finger test, I'll position my fingers between your superficial inguinal ring, the deep inguinal ring, and the femoral ring. So this is how you position the finger, and I'll ask the patient to cough. Now, based upon which finger you feel the impulse, you will diagnose whether it is a femoral hernia, an indirect inguinal hernia, or direct inguinal hernia, or an indirect inguinal hernia, based upon in which finger do you feel the impulse first. And that's a very, very important point to be remembered, right? Okay. Going on to the next question. The next question is identify the instrument used in perineal surgery. In perineal surgery and the surgery performed. And the surgery performed, right? Option A, circular stapler with stapler hemorrhoidectomy. Circular stapler with stapler hemorrhoidectomy. Option B, is it a linear stapler? Is it a linear stapler with stapler hemorrhoidectomy? Option C, circular stapler with fistulectomy. Option D, linear stapler with fistulectomy. So I got 4 options. I'm going to show you a video where you have to identify the instrument and what surgery did we use that instrument for, right? I'm going to show you the video. Is it a circular or linear stapler? Are you doing a stapler hemorrhoidectomy or a fistulectomy? Is what you have to identify. The question is simple. You have read the options, and let's now look at the video, right? Now, this is the instrument that is being shown to you, and this is what you have to identify. This is the entire set of the instrument. You can see there's a head, there is the lower end of it, there's a gun to fire, there is a marker that is present, and then there is this tissue that is present. Now, this is very important. I want you to observe it again. You can see that the whole device has been shown, right? And you can see the entire rim of this tissue which has been taken out. What do you think the option is? Now, first of all, what is a stapler? Is it a circular or linear stapler? You can see it is a circumferential circular. It's a circular stapler. Linear stapler will have 2 ends which are like this. They're going to be open-ended like this, and they close it like this. So the whole length is going to be stapled. This is what we call it as the linear stapler. This is a circular stapler. Now, this is what we call it as the donut of the rim tissue. How do you know that you have done a right surgery, that you have excised the right amount of the hemorrhoid tissue? Is by looking at this donut. If the donut is complete, you have done a complete resection. This is your circular stapler, and you have performed a stapler hemorrhoidectomy. So answer to this question is going to be A for Ahmedabad. That is, it is a circular stapler, and you have done a stapler hemorrhoidectomy. You have performed a stapler hemorrhoidectomy, right? Now, let's go with another question. Now, in this question, I have a 55-year-old female with complaints of inguinal pain. Nothing else, right? A clinical test is performed. The question is identify the test. Right? Option A, is it a ring occlusion test? Option B, is it a Zeeman test? Option C, is it a Hausche-Bromberg test? Is it a Hausche-Bromberg test? And option D, is it a Roos test? So I'm going to show you the video and I want you to identify. A 55-year-old female presented to you pain in the inguinal region. There's no swelling, nothing, right? And that pain is also intermittent. Now the clinical test is performed. I want you to identify what clinical test it is. Based upon the clinical test, I want you to identify what test did we perform, all right? So let's go into the video. Now this is that female. Now, in the video, you can see one limb is straight, the other is semi-flexed, and she refuses to extend it. That's the first thing, right? Now, you see that I'm going to do a couple of maneuvers. The first thing I'm going to do, I'm taking the knee and I'm going to push the knee on the other side. What is that called as? It is called as abduction of the knee, right? I've done the abduction of the knee. The patient is complaining about pain, right? Then I will do the medial rotation. Then I'll perform the medial rotation at the level of thigh. Again, there is pain. Now, the third thing, I'll try to extend the limb. Again, there is pain. So, pain on abduction, medial rotation, and extension of the lower limb. In which condition would you see all this, and what is this test called as? That's it, right? So, you're done abduction, you're doing an internal rotation, and then you are extending the limb, and all three maneuvers are causing pain. If all three maneuvers are causing pain, what do you think is the problem here? And the answer to this question, I know you have guessed it right. What is the answer? The answer to this question is correct. This is your Hausche-Bromberg sign, which is seen in obturator hernia. Which is seen in obturator hernia, right? So this is your Hausche-Bromberg sign, and this is what we call it as your obturator hernia. See, ring occlusion test, I would have compressed the deep inguinal. So in a ring occlusion test, I am going to use the thumb and we are going to occlude. We're going to occlude the deep inguinal ring. We're going to occlude the deep inguinal ring. Siemens test is for inguinal hernia, also called as a three-finger test. Roos test is for thoracic outlet syndrome. It's a thoracic outlet syndrome, right? So answer here is Hausche-Bromberg sign, right? Let's go to the next question. Next question is identify the procedure. Identify the procedure. Option A, creating pneumoperitoneum. Creating pneumoperitoneum. Option B, placing umbilical port. Placing umbilical port. Option C, doing a diagnostic peritoneal lavage. Doing a diagnostic peritoneal lavage. And option D is optical port placement. Is an optical port placement. So I'm going to show you a video and you have to identify the procedure. Are you creating a pneumoperitoneum? Are you placing an umbilical port? Are you doing a diagnostic peritoneal lavage? Or you are actually placing an optical port? This is what you have to identify. The options are very clear, right? Now this is the short video that I would like to show, right? Now, the first thing you see that there are these Alice forces which are holding onto the umbilicus, right? And I'm holding this instrument. Now, this instrument is what I am going to insert, right? So you see, this is the whole length of the instrument that I'm showing you across, right? We are also done the saline irrigation test to see whether the entire needle is patent. You're flushing the saline and it is going through it. This is called as the saline irrigation test, right? Saline irrigation test is performed, all right? Now, what I'm going to do is I'm now going to make a small incision in the umbilical region. After making a small incision in the umbilical region, I'm now going to insert this particular device. Now, what is this procedure called as? Where you're inserting a device and you're doing something. Now, I've lifted the lower part of the abdomen and now I'm inserting this particular device. And inserting this particular device, to do something, right? So the question is exactly asking you this: what is this procedure called as? What is your answer? First of all, what is this instrument? What is this instrument that I'm holding in my hand? क्या है ये instrument? क्या है ये instrument? This is your Veress needle. And what you have done right now, it is basically to create pneumoperitoneum, you're inserting this needle. Now, there are a lot of questions that they can ask you around this. First question is, in which direction will you insert the Veress needle? Is it towards the pelvis or towards the xiphisternum? It is always towards the pelvis. Second, what is the angle between the Veress needle and skin? 90 degrees. What is the angle between Veress needle and body? It is 45 degrees, right? Why do you insert Veress needle? To create pneumoperitoneum. What is the most common gas used to create pneumoperitoneum? Carbon dioxide. What is the initial flow rate of carbon dioxide? 1 to 4 liters per minute. What is the maximum flow rate of carbon dioxide? 20 liters per minute. How much should be the intra-abdominal pressure during pneumoperitoneum? 12 to 15 millimeters of mercury. All these are your questions. The only thing, see, everything we have already learned. The only thing they're asking you is in a different pattern, and that is a video-based question. And the answer to this question is, what are you doing here? I am creating pneumoperitoneum. I am creating pneumoperitoneum, and when you have created, in order to create pneumoperitoneum, we are using Veress needle. So the video that I showed is about Veress needle. As simple as that. Clear? Perfect. Now, let's go to another question. Now, 5 weeks old male child with gastric outlet obstruction. Now, this patient is taken for surgery. Identify the procedure. Identify the procedure, right? Now, option A, is it Swenson's? Option B, is it Duhamel surgery? Is it Thierch surgery? And is it Ramsted's surgery? Right. So you have a question where you have a 5 weeks old child presented with gastric outlet obstruction, and we are doing a certain procedure or a surgery for this kid. I want to identify the surgery that is given to you. If you know these options, you already know the answer, but let's visit the video and then we'll come back. Now, this is the video that I want to show you. Now, you can see this is a laparoscopic view. This is the liver. Just under the liver, what do you have? You have to identify this. This is what you have stomach, and it continues into the pyloric part and then into duodenum. And this is the area that you're identifying. Now, what you're doing, you're using a endocautery hook. You're using an endocautery hook, and that endocautery hook, you're actually marking the area on the serosal surface of the stomach. And now you're opening the serosal surface. After opening the serosal surface, I will slowly take up an grasper. This is your atraumatic grasper that you have, or Maryland forceps. With the help of Maryland forceps, I am dissecting it. I am opening and breaching the muscular layer. I will breach the muscular layer till I reach this whitish layer that is going to pop out. Now, the whitish layer that is popping out is your submucosa. So, what is this procedure? Where you're cutting from the serosa all the way to submucosa. You're not cutting the submucosa, you're cutting the serosa, the circular longitudinal muscle and the circular muscles, allowing the submucosa to pop out. This popping of the submucosal surface in a surgical procedure is called as, what is this condition? See, if you already know the question, you know the answer. A 5-week-old male child with gastric outlet obstruction, the most common cause is congenital hypertrophic pyloric stenosis, and the surgery of choice for CHPS is going to be, your Ramsted's pyloromyotomy. It is going to be your Ramsted's pyloromyotomy. Swenson's and Duhamel's is for Hirschsprung disease. Thierch surgery is for rectal prolapse. Thierch surgery is for rectal prolapse. As simple as that. All right. So, answer to the question that we have just solved is your Ramsted's pyloromyotomy. Right. Now, the last question that we have for today is going to be identify the instrument, or rather identify the device. Option A, Is it a 24 hours pH monitor? Is it an ambulatory pH monitor? Is it a capsule endoscope? Is it a capsule endoscope? Is it a endoluminal manometer? So I'm going to show you a particular video of a device and I want you to identify that device. That's it. So is it a 24 hours pH monitor? Is it an ambulatory pH monitor? Is it a capsule endoscope? Is it an endoluminal monitor? Is what they're going to ask you as a question. So let's look at the video. Now this, by the first image only, you should know the answer, but I'll play the video so that you see the entire spectrum of it, right? So you can see that this is the device and this device has two markers which are going to present and they glow. They actually, if you see the last part, that is very, very important. The last part, if you see, they are like small light bulbs are there. They're actually going to glow, right? What is this? The answer is correct. It is your capsule endoscope. So answer to this question, it is going to be your capsule endoscope. For a 24 hours pH monitoring, you have a pH probe. There is no pH probe here, right? So there is pH probe that is present. For an ambulatory pH monitor, you have a portable device attached to the body. So there has to be a portable external device. This is a portable external device which is not seen. This is a capsule endoscope. Endoluminal manometer is basically a hoax, right? It is a false or misleading option. There's nothing called as an endoluminal manometer. So answer to this question is going to be capsule endoscopy, right? All those guys who have just joined us, let's do a quick recap. The first question that we had is we are having a 12 years old boy with a dynamic bowel obstruction and the video played was this, right? I want you to identify what is the procedure or the condition that you have. In this condition, you can see that one loop of the bowel is telescoping into another. There is no rocket science. Everybody can identify. If a proximal end of the bowel loop goes into distal end of the bowel loop, this condition is what we call it as intersusception. In volvulus, it is going to rotate on itself. There will be a massive ballooning that you will see. So hence the answer here is going to be intersusception. As you can see, the proximal end of the bowel, as we continue to pull, we're milking the bowel loop and this is your intersusception. So the first question, the answer was intersusception. The question number 2, I had a 25-year-old female with complaints of swelling which is intraoral as well as in the neck region, gradually increasing in size. This was actually a bouncer for today and I knew most of you would get this wrong, but I'm here to help you out, right? So I want you to look at this particular video and tell me the diagnosis that you're able to see. Now there's a patient with an intraoral swelling, right? The swelling is present in the intraoral region. There's an intraoral swelling which is symmetrical on both sides, right? And it is under the tongue and there is a swelling in the undersurface of the neck as well, right? Now, what condition or what swelling can present to you both intraorally as well as extending into the neck region? There are two conditions. One, it could be your plunging ranula. Another one, it could be your sublingual dermoid. How do you differentiate? The word ranula itself means frog's belly, which is blue in color. The swelling is not blue. First point against ranula. Second point, ranulas are asymmetrical. This is a symmetrical swelling. Third, you can see we are doing a transillumination test. Ranulas are having positive transillumination. Here, the swelling is not glowing. If the swelling was glowing, the entire swelling would have brightened up. You can see the light on the inferior surface of the neck also, which is not seeing here. So it is negative for transillumination. Ranulas are positive for transillumination. So ranulas are number one, they are asymmetrical. They're blue in color and plunging ranula, ranulas per se will have brilliant transillumination. The difference between ranula and plunging ranula is limited to intraoral. If it extends to neck, it is plunging ranula. What is the difference? Ranula is an extravasation cyst, plunging ranula is a retention cyst. But now here, neither it is, see, this is swelling. If you look at this particular video, in this particular video, you see the swelling is symmetrical. First thing. Second, it is not blue in color. Third, there is no transillumination. Fourth, as you can see, it is extending into the neck surface area, but irrespective of symmetrical arrangement. Now, this is a classical diagnosis going to be your sublingual dermoid cyst. Is everybody clear with that, right? This is a very, very important video-based question that can be asked. Now, next question, I said a patient undergoing a laparoscopic cholecystectomy. There's a structure that is pointed out. Identify the structure. Please do not say ranula or plunging ranula. I've given you the difference. Keep that in mind. Very, very, very important. Now, a laparoscopic cholecystectomy, identify the structure. This was the video that I've played for you. I wanted to identify the structure. What is this? You can see this. It's a pulsating structure and it is going into the calyx area. And the answer is going to be a caterpillar's or a Moynihan's hump, right? A caterpillar's or a Moynihan's hump. It cannot be Phrygian cap because Phrygian cap deformity is in the fundus of the gallbladder. It is not a normal anatomy. It is not a double cystic duct. Cystic duct appears to be as a simple location that is there. Next question, I had a 45-year-old female with swelling which is present in the midline of the neck, gradually increasing in size, and the video is given. They're asking you to identify the condition. This is the video that you need to see. A 45-year-old female with the swelling in the midline of the neck. You can see swelling is present here. The first thing I'm asking her to swallow. The swelling is moving upwards with degglutination, so I'm associating with thyroid. I'm asking her to stick the tongue out. With every single time she sticks the tongue out, you see the swelling also moves upward. So swelling moving upwards with tongue protrusion as well as with degglutination. The only answer that goes in favor is going to be your thyroglossal duct cyst, and that was the answer here. It is your thyroglossal duct cyst. Next, we said I have a patient with a swelling in the inguinal region. We are doing a clinical test. Identify the diagnosis. It's a 3-finger test that you have done. And you see the impulse is now felt on the index finger below the level of the inguinal region. I'm asking the patient to cough. With the coughing, you can see the impulse is felt on the middle finger. The impulse is felt on the middle finger, right? Now, again in the 3-finger test, they'll ask you very specifically where are you going to place the fingers. The index finger, I think initially I've told a little bit ulta. The index finger is put at the superficial inguinal ring. The middle finger is at deep inguinal ring, and the your ring finger is put at the level of your femoral ring. Now, if the impulse is felt on the middle finger, it is femoral hernia. Middle finger is going to be indirect inguinal hernia. Index finger is going to be a direct inguinal hernia. As simple as that, right? So the answer here is going to be your femoral hernia. Next, I asked you, I'm going to show you the instrument. Identify the instrument as well as procedure. The instrument shown in the image was this. Now, this is identify the instrument. This is your circular stapler, and this is what a donut of tissue, which is done in circular stapler hemorrhoidectomy. That was the answer for this question. Next question. I had a 55-year-old female presented with swelling in the inguinal region. We performed a clinical test. I asked you to identify the clinical test. The clinical test performed was this, right? I have a female. Now you can see the limb, affected limb is semi-flexed. So what I'm going to do is, first I will try to do an abduction of the knee, right? This knee part, I'll do an abduction of the limb. The minute you try to do an abduction is to move away, the patient complains about pain. Then we'll try to do an internal rotation. I'll flex the limb and then I'll try to do an internal rotation. Again, it causes pain. Third, when I try to extend the limb, it causes pain. So pain on abduction, internal rotation and extension of the limb. This is what we call it as the Hauschip-Romberg sign. Now, this is what we call it as the Hauschip-Romberg sign. And Hauschip-Romberg sign is seen in obturator hernia. We've already discussed about it. Next, I asked you that we are going to show you a procedure, identify the procedure. And this was the procedure that we had shown you. Now, here you can see there's an instrument that we're going to show you. This is the instrument you have to identify. This is your Veress needle. Now, Veress needle we are going to insert into the umbilical region, right? So this is where the entry of the Veress needle. The angle between the needle and the skin is 90 degrees. I'm going to lift the abdominal wall up, right? I'm going to lift the abdominal wall up and I'm inserting. The angle between the needle and the abdomen and the skin is 90, but angle between needle and the body is going to be 45 degrees. Now, what is this procedure called as? This procedure is called as Veress needle insertion to create pneumoperitoneum, and that was the question that we've asked. What is the procedure done? It is to create pneumoperitoneum. We're using Veress needle. As simple as that. Next, I asked you, I have a 5-week-old baby with gastric aortic obstruction. We're doing a surgical procedure. Identify the surgical procedure. And this was the surgical procedure that we showed you. You can see here, this is the liver, this is the stomach, and this is the pylorus of the stomach. And you can see this is where we are going to do a pyloromyotomy. You can see here we are making a mark, opening the serosa. After opening the serosa, dissecting the longitudinal and circular muscle. After dissecting the longitudinal and circular muscle, there's an atraumatic grasper. I'm inserting the grasper. I am opening this muscle. I'm dividing the muscles, and this is the submucosal pop. Presence of submucosal pop indicates we are doing a Ramsay's pyloromyotomy, and that is what we were asking you. What is this procedure? It is Ramsay's. Swenson's and Duhamel's is for Hirschsprung disease. Thiersch-Weiring is for rectal prolapse. So hence, this is going to be your Ramsay's pyloromyotomy. The last question that we asked you is identify the device that is shown to you. This is the device that we've shown. We can see very clearly that it's a small device which is having two radio opaque lines, and it also illuminates. And this is going to be the transmitter, and this is your capsule endoscopy, right? So these were the 10 questions that I wanted to discuss on the video-based components. From today onwards, we at MedEd are going to do an entire series of video-based questions for all 19 subjects so that you get sensitized and be ready for your NEET PG exam. If you have any questions, I'm here for you, or else thank you so much for joining. It was an amazing session. Thank you for being here. And if you have any questions, I'm here to take those questions as well. All right, so if you have no other questions, right. So the entire video library as well as the PPT will be available on the MedEd app. You can go download it. It is going to be a free access to all. It is called as an Achievers Batch. Please do go and download, and you will get tons and tons of for Mohin and Sump, but it's just an arbitration. You don't need to do, there's no treatment of Mohin and Sump. The only thing is, while doing the surgery, don't meddle with Mohin and Sump. उसको छेड़ना नहीं है. मोइन एंड हम को छेड़ोगे तो फिर वेसल ब्लीड करेगा तो प्रॉब्लम हो जाएगी, एंड दैट इज सप्लाइंग टू लिवर. तो henceforth मोइन एंड हमको आइडेंटिफाई करके उसको बाजू कर दो. Yes, so we'll be doing a lot of clinical based videos also. So today you have seen I've created a mixed bag of clinical videos, surgical videos, and instruments, and this is what we're going to emulate again and again. And we will make sure that before you go to the exam, you are exam ready with the video based questions also. Okay? All these videos with a proper explanation as well as the question as well as the PPT will be available on our MedEd app. It is called as the Achievers Batch. All right. Thank you so much for joining. Take care. If you have any questions, you can reach out to me on my Instagram handle. That is going to be the surgery guy. I think most of you know it, but just for the sake of completion, if you are having any delay, you can reach out to me on the Instagram. That is your surgery guy. And it will be on my name, that is Dr. Sandeep Sir Reddy. कोई सवाल कोई शक तो डायरेक्ट पूछ लेना, कोई टेंशन नहीं है. ऑलराइट, थैंक यू सो मच फॉर जॉइनिंग. सी यू अगेन. दिस सीरीज विल बी रनिंग ऑन YouTube, बट दी पोस्ट सीरीज आपको एनोटेटेड नोट्स और वीडियो अगर रीअसेस करना है वो आपको मेड ऐप पे मिल जाएगा. ऑलराइट, थैंक यू सो मच.